In an ER, it's not fair that I have to endure the amount of suffering that I do, and I'm not allowed to show that I'm scared without being treated like an inmate and thrown into a psych ward. In those places, they don't mind that your blood pressure is dropping into the 60s or that you need an infusion, and they won't help you at all. They just look at you like a bug and tell you there's something mentally wrong with you for being a human and crying because you're scared as your body falls apart. These are the people I'm supposed to learn to trust again, even though they have never showed mercy on me. I have to hide behind a mask every time I go to a doctor's appointment. Maybe it's because I'm a woman. If I don't wear enough makeup or dress up, I'm viewed as a crackhead, lying about my illness because I'm crazy. But if I wear too much makeup and say all the right things properly, or do it too much, covering up my pain as much as possible, it means that I'm also lying about being sick because I don't look sick enough. Yet they don't know the amount of times and the amount of strength it took me to not allow myself to die because of their ignorance. They don't know or care how many years I was bedbound because of them ignoring me. They don't know how many times I would wake up in the morning with blue lips and white hands, gasping for air while they just turned me away. They don't know how many times I have had anaphylaxis and came to them for help while they literally laughed in my face and threw me out into the parking lot cement to suffer and possibly die by myself. They don't know what it's like to be me, and they don't care. They don't know what it's like to be a sane person who fainted from their disease only to be brought into a psych ward and interrogated instead of helped. They don't know what it's like when doctors leave the room and the nurses come in and make fun of me, telling me that I'm crazy for wearing a gas mask because I get anaphylaxis to smells. They don't know what it's like when they laugh at me and call me a joke. You don't know what it's like to be told to go home and never return to the hospital, or to go home and hope to not die by the people that are supposed to be saving our lives and helping suffering and comforting those who are scared. They don't know what it's like to have heart palpitations that make you black out and pass out, or a stomach problem where you couldn't eat for years at a time without vomiting every day, only to be told that you're too young to have problems. For 10 whole years. They don't know what it's like to have every doctor refuse to test you for anything for over a decade, while you suffer and wish for death. They don't know what it's like to hear bad news that after 10 years of not receiving a diagnosis, you get the worst news possible that could have been fixed throughout all those 10 years if someone had just listened to me. But since they didn't listen to you, it turns out it turned into something deadly. The suffering is their fault. They don't know what it's like for us to have to mentally prepare ourselves to go to every doctor's appointment knowing that they're going to gaslight us and think that our torture is made up, not even being aware or caring that they are half of the reason why we are tortured in the first place. They have no apologies. They don't know what it's like to suffer and be refused a helping hand by those who swore an oath to help and save lives. They don't know how much we have to conceal just to get by and not be judged. They don't know what it's like for doctors to drop them as patients because they're too sick to get to doctor's appointments, where they're just going to be ridiculed and not helped anyway. We are labeled as non-compliant when in fact it's them who are non-compliant. They don't know what it's like to have doctors put fake medical information on their treatment plans and in their records just to spite us because they hate us for being chronically ill and begging them for help. They don't know what it's like to make sure that you are being as nice and as soft-spoken as possible with doctors, that they don't think you're crazy, but they still do anyway. They don't know what it's like to be suffering severely every single day of their life and not be allowed to talk about it. They don't know what it's like to not be able to dress or bathe yourself or put on your own shoes for years at a time with no one around to actually help them do it, because doctors refused to take them seriously and help them. They don't know what it's like to have to do years of medical research and studies on their own in order to help themselves because doctors refuse. They don't know what it's like to have Google actually be the one to end up saving their life multiple times when a doctor refused. They don't know what it's like to have to crawl on the floor to get yourself a glass of water. They don't know what it's like to go to a doctor and not even be able to get one word in because they're already mad at us for explaining our illness. They don't know what it's like to leave every doctor's appointment shaking and in tears, but having to hide it until you get to your car so that they don't automatically want to throw you into a loony bin. All because they were angry at you for being sick, or they called you crazy in some way for having an illness that they don't understand and they refuse to learn about. They don't know what it's like to be having a day full of fainting spells, heart issues, stomach issues, and problems with motor skills, while having to do the best they can to look normal on the outside by putting makeup on and decent clothing, just so that when they go out or to a doctor's, they're not looked at badly and they can be taken a little bit more seriously. They don't know what percentage of people with this disease actually end up committing suicide, and they don't care to know. They also don't know or care that the majority of the reason for the suicides is because of them and their ignorance. They don't know that every one of our stories are the exact same. They get to live their lives perfectly and carefree. They get to harass us and ignore us, and they go home after a long day's work and be with their families. They have friends. They're able to do their own laundry. They're able to cook food. They're able to take showers without a worry. But then they come to work and harass us. And the patient is the one that's always looked at as the bad guy, when all the patient wants is someone to help ease their suffering, like these doctors are supposed to do in the first place, just to do their job. They have no remorse. This is the war that us with dysautonomia have been fighting, not just with our bodies. It is a war that has to end. We are told that we are supposed to watch what we say to doctors, when it's really the doctors that have to watch what they say to us, because we're the ones they kick in the stomach with their harassment and their ignorance and their yelling matches, while we are the sufferers begging them for help. We're already suffering enough. Why should we be the ones to leave a doctor's office in fear and shaking and tears? When we do everything right, we dress decent, we look the part, speak with softness and kindness, then yet we are still told that we need to do better when talking to doctors? No, that's unacceptable. Patients with chronic patients with chronic illness need to be taken seriously and treated as human beings for once. We are tired of being laughed at and harassed and ridiculed and threatened and yelled at by doctors who just don't care to do their jobs correctly. They don't even understand or care that at least half of our problems, and the only reason all of us end up with PTSD, is because of them. Everyone I have talked to with my illness developed PTSD because of doctors. It's ridiculous and completely unacceptable, and they need to be the ones to change, not us. We are the true warriors, and they would not last 5 minutes with our disease. I guarantee it. Most of us do everything we can to not get suicidal. I have watched so many people with forms of autonomic dysfunction and dysautonomia die because doctors didn't listen to them or take them seriously, even long after a diagnosis. And I am not even exaggerating. The only way to end the war with this is to properly educate medical people, and to do that starts with awareness, and nobody seems to care to spread it. I shouldn't have to tremble in fear every time I have a doctor's appointment, and neither should anybody else. The amount of suffering that we go through is bad enough. We don't need them to keep inflicting more suffering on us for no reason other than their own ego trips. They don't know what it's like, and they don't care to know what it's like. I have been trying for years to get over this, but I don't know if I can unless something has changed. Why is that? Because it's still happening every single time I go see a doctor. How am I supposed to recover from something that keeps happening? How am I supposed to view them as anything but terrible when all I keep getting is terrible? The amount of gaslighting that people with chronic illness from doctors get is disgusting. People spend time trying to fix patients' outlooks about it and teach patients how they can better deal with doctors while not actually trying to fix the doctors and how they actually deal with people like us. It's not us with the mental problem, it's them. I now believe that it is them in reality that really needs the therapy and need to be examined under a microscope. Because the rest, we do everything in our power to change ourselves to better serve these bad, harassing, neglecting, ignorant doctors. We're the ones who are suffering and needing to be fixed. When a doctor is non-compliant for absolutely no reason, or starts yelling at the patient for no reason, or starts laughing in their face for no reason, or just tells them that they're crazy or making up their illness for no reason, or puts fake information in their medical records just to spite them, how is that my fault? How is that I need to change? Why am I the one that needs to be changed? I'm not buying it. It's not me, it's them. Ask any person dealing with this illness or any other chronic illness, and they will tell you the same story as I. And just think about it. Who are the real crazy people here? Yes, there are great doctors out there, but if you have a chronic illness, this is what you have to deal with. It's just very sad facts. And I'm tired of having to sugarcoat everything that they have put me through so that I don't look like a crazy person to someone listening to this. But this is the truth. It's not even just my truth. It's all of our truths. We all have the same stories. Are we all crazy? More and more people are ending up with autonomic dysfunction from COVID-19, and there's going to be no doctor that knows or cares how to treat it. And they're going to be called crazy. So what then?